Well, hello. Welcome to Love Has Many Faces here on Alternative Talk 1150. I am your host, Marilyn Milano, and I am pleased to be bringing back a guest who has been with us many times. It's Mari Maeda from Canine Cancer Research Alliance. She has in the past shared updates with us about clinical trials, told us some stories of uh, wonderful, hopeful improvements with animals who have been diagnosed, and will tell you a little bit more about what their organization is doing. So it's always good to catch up and hear what is new. And while I am here talking before we bring our guest on, just a couple of quick reminders, everyone. We are now podcasting. So not only can you listen to us on Alternative Talk KKNW 1150, but anywhere you get your podcasts, if you type in Love Has Many Faces podcast, it will come up and you can share with friends. And we want you to share because it is getting the word out to more people. We always try to feature rescue groups, medical research, products and services, everything that helps animals and their people. That's what this is about. So please do share. And again, if you prefer to listen in the more traditional way, you can catch us every Tuesday morning from 9 to 9:30 Pacific time on the radio itself, or you can stream from the Alternative Talk 1150 website. So anyway, now that we've got that out of the way, we're going to take a very short pause, and we will come back with our returning guest, Mari Maeda, to talk about canine cancer research and some hopeful stories and some updates. I'm Marilyn Milano. We'll be right back.
This is Martha Norwalk. Every Sunday morning, beginning at 9 a.m., thanks in part to NewProSupplements.com, we cover the world of animals. This week, August 31st, it's an encore presentation. Tune in to hear our last healing show with Dr. Nels Rasmussen and Linda Rasmussen. Together, they helped callers and their animal friends with emotional, behavioral, and physical issues, and you can receive a surrogate healing just by listening and following along with Linda's instructions. Martha Norwalk's Animal World, Sunday morning, 9 a.m. to noon, right here on Alternative Talk, AM 1150.
Hi, I'm Coach Debbie from Story U Talk Radio, and I want to encourage you to write your book. Weekly, I offer topics about style and storytelling. I take your questions on our live show every Thursday at 4 o'clock, or you can subscribe to Story U, that's capital U, on any of your favorite platforms.
Alternative Talk, 1150 on AM, 98.9 HD3 on HD, 1150kknw.com on the web.
Well, welcome back to Love Has Many Faces. And as I mentioned, we have a returning guest from Canine Cancer Research Alliance, Mari Maeda. So, Mari, welcome. Thanks again for joining us today.
Thank you so much, Marilyn. Thank you for having me.
It's always a pleasure. It's always great to learn more about what's new, what's going on with your organization. I know that you've had your own personal journey with your dog, Momo. So I thought maybe we'd start with that. Well, actually, you know what? Before we start with that, I know there are probably a few people who have not heard you before and don't know about your organization. So how about just a quick little intro about who you are and what your group does?
Yes, of course. So Canine Cancer Research Alliance, or we sometimes call it Canine Cancer Alliance, is a nonprofit organization based in Bellevue. And our mission is to support research so we can find cancer prevention, cancer cures for dogs, pet dogs. And my dog, we have three golden retrievers. And previously we lost our Goldens to cancer, and that's what instigated me to start the nonprofit, because we know that there are so many researchers with really wonderful ideas. And if we could get them into clinical trials to get their new therapies evaluated, then there's a chance of getting it actually accessible and available to many dogs. And ultimately may become available to humans as well. But our organization's focus is on dogs. And right now we have three golden retrievers, and I'm a retired physicist by training, and running this organization. I'm talking to researchers and clinicians every day. And when Momo, our 9-year-old golden, started acting a little bit off, she has a good appetite, but after she finished eating, she would just go back to her bed and just lie around all day. There seemed to be something wrong with her. So I've been taking her to the vet, asking the vet, could this lump be something? What other tests can we do to see if, God forbid, that she might have cancer and try to catch it early. So for the last 2, 3 months, I've been really worried about Momo, bringing her back to the family vet and trying to see if they could do any tests to really understand, what might be causing her to act so fatigued all the time.
Mm. Hmm. And no definitive answers yet?
So, this is what my husband said. My husband says, "Well, you're talking about cancer every day because that's what I do. And so if your mind is kind of thinking about cancer, you're going to conclude that it's going to be cancer. But, there's some chance that she doesn't have cancer. So I hope my husband is right. Our vet ordered a test. It's called IDEX Cancer DX test, and it's blood test. So she sent in Momo's blood sample, and that was August 1st. And about a week later, she called us back and said it came back positive for lymphoma. So this particular test only tests for lymphoma, and its false alarm rate is supposed to be very low. So it's not supposed to make mistakes. If it says it's positive for lymphoma, then it's 99%, accurate that it's going to be lymphoma. So
Okay.
they said, okay, it's probably lymphoma. So, so we took her back, and the vet felt around for her lymph node because with lymphoma you get swollen lymph nodes,
Yeah,
but it could sometimes be like internal, so you can't feel it.
sure.
So yeah, so they did X-rays and they took ultrasound to see if they can see anything. And they couldn't find anything that seemed to be lymphoma, but they did find something in her lungs that looked very suspicious. So they aspirated the mass, and aspiration just means that they're using a needle to take a little bit of
Right,
cells,
right.
and they sent it in. And they also aspirated a lymph node on her throat that seemed a little bit swollen, not too swollen, but just a little bit, and sent that in. And both tests came back inconclusive.
Mm,
Um, so, um, so we do have an appointment now with an oncologist next week who's a specialist. So he will do more tests and order more um, evaluation. And I just didn't realize how difficult it is to actually positively diagnose cancer and find out what kind of cancer it is. Or our vet says maybe she has two kinds of cancer, lymphoma and something else in her
oh
blood.
boy.
Yeah. My husband says probably she is just getting old and she's just fatigued and she has nothing. So we will find out.
And maybe the truth lies somewhere in between. But it's true. And yet sometimes, I mean, I know of people where they've gotten a diagnosis quickly. I mean, even in the case of my old 15-year-old pup, I had three dogs, and my old guy was really slowing down, and I thought it might be old age related. And the blood tests came back a little off. The red was off, the white was off. And the vet said, it could be bone marrow. The tests for bone marrow are painful. They're invasive. He's 15. He's fragile. And I said, well, can we do a scan, to just see? And I'll be darned if in the scan it was conclusively cancer of the spleen. And he had really been slowing down. All he wanted to do was sleep. And he used to gobble his food. He wasn't that interested. But anyway, realizing that a spleen cancer could also rupture and seeing how fast he was declining, I said goodbye to him, and I'm still heartbroken. But I mean, we were able to find out pretty soon. And yet, I know with one of my other dogs back in the past, we had to do a number of tests. And finally, there was a needle aspiration that did confirm she had multiple myeloma. But it's so hard. I don't know if you're like me, maybe not because you're a researcher and you're used to these kinds of things. But as a pet owner, and even for myself, I just about have heart failure waiting for results. I am so nervous. And when you wait and you don't get answers, it is so difficult for so many of us. So,
Exactly.
my first
Yeah.
question is, What do you think is the best way to deal with that? I mean, obviously, you're going to keep going until you have answers if you can get them. Do you have
Yeah.
any recommendations for pet parents besides like just keep trying to get answers until you have something? I mean, what do you suggest?
It's really hard. Exactly. So for us, it's now almost a month, and we still don't have answers. And we know that early detection, if you can catch cancer early, you get much better chance of actually treating it and then even curing it. So you want to get it early, but then the clock is ticking. So I feel like, oh my gosh, it's starting to spread. What's going to happen? It is so stressful. Now, the good news is that there are new developments in treatments. And before, and many doctors will still say that you want to get the cancer surgically removed as early as possible with clean margins. And if it doesn't look like you have clean margins, then do chemotherapy. And this is all after you diagnose the cancer as,
Yeah.
this or that.
Yes.
You have exact diagnosis. Then you
Yes.
take action. But I think in the future, and we're not quite there yet, but in the future, there's going to be other treatment options where even if you don't know what it is, you may be able to start something sooner than later.
Oh,
So
that'd be great.
I'm talking about something called immunotherapy.
I've heard of that.
Um,
Yeah.
Immunotherapy, yeah, it's huge in human medicine because it's led to cures for um, a subset of patients with aggressive metastatic cancer. You can't cure everybody yet, but there are types of cancer where doctors would never use the word cure, but they are starting to use it now because they could actually get subset of patients to respond. So with dogs, our nonprofit has been funding a number of different immunotherapy clinical trials. And instead of using something like chemo, where you're indiscriminately trying to kill all the fast dividing cells, you you help and arm the immune system to target cancer cells only. And so it could be gentler. It has a systemic effect. So even if cancer is spreading, immune system could go and find it. Um, and the other really exciting thing is you could actually create memory in the immune system. So it's long lasting. The immune system will continue to remember and fight and kill those cancer cells. So if immunotherapy becomes more widely available, I believe that there will be in future, even if you don't know exactly which type of cancer it is, that you might be able to get immunotherapy started.
That would be so wonderful because I know with people, with pets, it's just gut-wrenching. Um, it's so hard. And with our animals, they can't really tell us and answer questions. I mean, we can be very tuned into how they're feeling and how they're behaving, but it can just be so darn hard. And how wonderful it would be if we could do something that could stave it off, even as we are trying to find more solid answers. Because sometimes, it sounds like anyway, by the time you have a solid answer, time has been ticking and perhaps it's becoming worse.
Exactly. Exactly. That's what I'm worried about, and many families are worried about. And right now, most people will try to do surgery as soon as possible. Just get rid of it, and then they say, okay, and then what do we do? But one of the things I wanted to share with you is there is a new immunotherapy treatment that just recently became available around the U.S. Anywhere in the U.S., you could get it, and it's called Elias immunotherapy. Now, this is not one of the treatments that we helped develop. This was actually developed by a small company in Kansas. And they've been running clinical trials with their immunotherapy, and they're finally approved by the USDA. So it's not experimental anymore. You don't have to be part of a clinical trial. You can talk to your vet and order it. Um, and and the thing to know with this immunotherapy is you have to know that you want to get it before you have surgery. So if you have surgery and then later you say, oh, I want to try the immunotherapy, it's too late because you need to actually save the fresh tumor sample, which is sent to the company, and they make a vaccine, cancer vaccine from
Oh
it.
my gosh.
And then they inject that into the patient. And that cancer vaccine will stimulate the immune system. And then they do something called apheresis, where they remove the T cells from the dog. And then they send that T cells to the lab and activate it and multiply it. And then they reinfuse the T cells back into the dog. And so
Wow.
it's a multi-step immunotherapy, but and it is pricey. It is pricey, uh, and and it does require surgery. But you need to know that you want to do this because the surgeon can harvest the tumor and save it to make this vaccine and do the immunotherapy. So,
Wow.
um, and the really exciting thing about this therapy is that a recently shared result says that 12 months survival rate for dogs with osteosarcoma, which is a very aggressive bone cancer, is 71%, which is much higher than with conventional therapy of just surgery and chemotherapy alone.
Wow.
So if you get ELISA immunotherapy and just add one dose of chemotherapy to ELISA immunotherapy, you can get 71% survival rate, which is really, really excellent number.
Well, we all want to keep our beloved pets with us as long as we can, assuming that their quality of life is good. Now, before we continue, I want to just stop to give people your website information. So if they want to dig deeper or reach out to your group, they can do that. So can you share that with us just so everybody has that?
Yes, thank you. Yeah, so we ccralliance.org. If you
Okay.
just search Canine Cancer Alliance, then it should come up with the website. And we also have a Instagram and Facebook page, and
Okay.
YouTube as well.
Okay.
Uh, we
That's
do lots of
great.
webinars. Yeah.
So, and for people that are older like me, if they remember Creedence Clearwater Revival, they will remember CCR. Um, but absolutely, yes. So check that out. And I'm assuming if people even go on Facebook and look up Canine Cancer Alliance, that it will help take them to your Facebook or Instagram accounts.
Yes.
Okay,
Yes.
that's great to know. Now, you had mentioned before that certain breeds seem to be more prone to cancers, and golden retrievers are one of those breeds, at least in recent years. Is that correct?
Absolutely, they are. And it's usually very large dog breeds like Great Danes and Bernese Mountain Dogs, but Goldens and Labs tend to get cancer more frequently. And sort of the median age when they start getting cancer is around 8 and a
Oh,
half, which is really, it's just heartbreaking.
oh yeah.
Um, and the types of cancer that they end up getting are hemangiosarcoma, which is a cancer in the blood lining,
Yep,
which happens very suddenly. There's just very little warning.
right.
Lymphoma, mast cell tumors, osteosarcoma, melanoma. But if you take 10 dogs with 10 golden retrievers with cancer, 7 of them will have hemangiosarcoma. That's how frequent hemangiosarcoma is.
Oh, so that's
Yeah,
that's that's scary because that's, as you said, that's a fast acting one, and it's very difficult to get on top of that one.
that's right. And most of us have never even heard of this cancer. In humans, they call it angiosarcoma. They have a different name, angiosarcoma, and it's very, very rare. But sometimes it's triggered by exposure to environmental pollutants. And some researchers suspect that hemangiosarcoma incidence rate may be rising. There is really no data to support that yet, but some do suspect. But 70% of Golden's cancer is hemangio. When I saw that number, I was just shocked.
Now, is there any clinical trial for that particular type of cancer or not yet at this time?
Yes, there is. So, Canine Cancer Alliance, we are supporting a number of different clinical trials, but one in particular has shown that it does help extend the survival times for hemangiosarcoma. So, this trial is with something called EGFR HER2 vaccine. That's a mouthful. Sometimes people call it EL vaccine because it was the researcher who invented it is at Yale University Medical School. So this Yale vaccine or EGFR HER2 vaccine is available in Seattle area at Bridge Animal Referral Center. And it's very simple treatment. It's 2 shots, 3 weeks apart. And if you contact BARC, which is in Edmonds, Washington, they'll they'll help you figure out if your dog qualifies for this clinical trial. And if your dog has osteosarcoma, hemangiosarcoma, or transitional cell carcinoma, which is bladder cancer, then you should qualify. And all you need to do is to make an appointment and they'll give your dog 2 shots. So you don't have to change your oncologist. You don't have to do anything, that's very expensive or anything. It's just a few $100s because our nonprofit is paying for manufacturing um, of the vaccine. And it does help stage 1 and stage 2 hemangiosarcoma patients live longer. We can't guarantee it's going to cure them, but it will help extend their survival time.
Well, and what most of us wouldn't give for just a little more time. Now, before we run out of time, and this always happens with interesting and enlightening conversations, we're out of time before we know it. But I know that you strongly believe in pet insurance, as do I. And I just wondered if you wanted to end our conversation with some encouragement for folks about really checking this out. I mean, and I'm not connected with the pet insurance company, and I don't believe you are either. So there's nothing in it for
I'm
us
not.
except that we understand. I mean, like they don't send you a toaster, right? But it's just so important. So do you want to speak to that for a minute or two before we have to wrap up?
Yes. The veterinary treatment costs are just rising and rising and rising. Now, if your dog has osteosarcoma or needs surgery, that can easily cost four, five, $6,000. But even before surgery, just to get the diagnostics could cost several $1,000s. And all these treatments like chemotherapy, depending on the size of the pup, um, it could again range from 3,000 to 10,000 or dollars or more. And I've spoken to many families who've already spent 20, 30, $40,000
Wow.
on the diagnostics and treatments. And if you have a good pet insurance where hopefully you don't have a maximum, you don't have a limit, I would choose one with kind of high deductible so the premiums are not too high. Um, every month you're going to feel like, oh, you're just throwing this money away. And, when I get the credit card bill every month and I see that $120 for Momo and $60 for our younger dogs, I feel like, oh gosh, am I wasting money? But I know that with just getting diagnostics done, it's going to pay back. Just you'll get your money back, and
Oh,
you
yes.
don't
I
have
mean,
to stress. This financials are not in part of your decision making. You don't have
that's
to
right.
say,
I mean, I think mine has a limit on it, but when I found out, I think I might have shared with you, my dog Fire had, and I'm probably going to mangle this, and let's see, what is it? Acanthomatic adenosarcoma. Anyway, it was a tumor that was non-metastatic, but it was in her jawline. And we did get it out and we did get clear margins. And thank goodness she's been doing wonderful. This was about a year and a half ago. But the insurance did pay for about half of it. And so, I mean, that was over $4,000. Now, if you're paying about 100 a month, you figure that's about 40 months. That's about 4 years of payments right there. And for many people, it is the difference between being able to move forward with helping your pet or not. So, I mean, there's a lot of differences between the policies. There are a lot of things to consider, but I am a huge proponent of pet insurance. So, I really encourage folks to look into that, see what might be right for your pet. Even if you don't use it for the first 7 or 8 years, once you have a larger bill, you're going to realize how valuable it truly is. And I've had pet insurance for my animals for well over 20 years. So, um, I'm with you on that. But anyway, it is time to wrap things up. Mary, I want to thank you for joining us again and thank you for this updated information. Best of luck with Momo. I know you'll let us know how that is going. Any last sign-off words for our listeners today?
Well, if you're going to get insurance, be sure you get it before there's suspicion of cancer, because they won't cover it right away. There's always like a month or two where they won't cover. So get it before cancer diagnosis.
That's right. Get it while your pet is healthy. It's just like people. Well, again, thank you. I wish you all the best of luck with everything that your organization is doing, with the clinical trials, with your dog. And I look forward to talking with you again down the road here in a bit.
Thank you.
Okay, we're going to take a short pause and I'll be right back to wrap up the show. It's Marilyn Milano with Love Has Many Faces here on Alternative Talk 1150.
Hi, this is Marilyn Milano, your host of Love Has Many Faces. The music that you're hearing during this show every week is exclusively original music from my own CDs. If you're enjoying it and would like to order a copy of one of my 2 CDs for yourself or as a gift, just go to marilynmilano.net and you can order directly from the website. I give a portion of every sale back to Animal Rescue because that's part of the whole cause. Thank you for listening and thanks for your support.
Alternative Talk 1150, the talk of the sound.
Well, thank you for listening, everyone. It's Marilyn Milano, your host of Love Has Many Faces here on Alternative Talk 1150. Again, an informative and helpful conversation with Mari Maeda of Canine Cancer Alliance. You can reach out to them if you've got questions. It's a wonderful organization. And I'm just sending good vibes and good wishes to anyone who's dealing with waiting for a diagnosis or who is concerned about a diagnosis. There is more hope out there than there used to be. And that's what it's all about. We want to get the word out. So thank you. I hope you all have a wonderful rest of your week. Until next time, this is Love Has Many Faces on Alternative Talk 1150.